Aloha, I'm Wendy Osher, and today we're joined by Dr. Vijak Ayasanonda, Emergency Department Physician and Co-Director of Maui Memorial Medical Center's Emergency Department. As you know, the official launch of the state's pre-travel COVID-19 testing program took place just last week. We're going to take a look at what that means for Maui's hospital. Dr. Ayasanonda, if you could provide us with an update on where we stand today in terms of ER visits from tourists or the non-resident population since the reopening on October 15th.
Thank you very much for having me again. I guess to start with, since October 15th, it's only been 5 days. So we have not yet seen a significant uptick in cases. I guess since the last time we spoke, we have had a successful increase in those who need emergency care actually seeking emergency care. And we did see a brief drop when we had increased cases in the hospital. With the return of visitors and opening of the reopening of the island, we probably anticipate there's going to be an uptick. But as of right now, we have not yet seen a very large, dramatic surge. We are preparing, though, and I'm sure we'll get into that shortly.
Okay, this is a viewer question, something that the public has expressed concern with in terms of capacity. Is the Maui Memorial Medical Center Emergency Department able to prepare to take care of visitors in addition to the residents?
That's an absolute yes. We are absolutely prepared. Now, we have been used to, for many years, taking care of both residents and visitors for a very long time. Our overall cases are still much less than what we were used to back when pre-COVID was. We're still probably at about 70%, 60% of our normal volume that we would expect this year. So we do have the capability and the capacity to take care of anyone and everyone who's coming, both visitors and residents alike. Of course, COVID presents a little bit more of a challenge. We do have to undergo more protocols to keep everyone safe, both staff as well as patients from coronavirus and other infectious diseases. So although we are still able to take care of everyone, it might take a little bit longer, but it's for everyone's safety and concern that we do this.
So is there any sort of coordination taking place between the hospital and say the hotels? What happens if a tourist tests positive? Do they go straight to the ER for care? And will they go back to their hotel if they have to quarantine?
Okay, let's see. So first, with coordinating the hotels, yes, I know that Maui Health is leading a safe reopening visitor task force, and we've brought together both the tourism industry as well as I believe the business leaders together, along with the County of Maui and the Department of Health, to provide education, communication resources to the hotels and resorts to ensure the guests and employees stay safe, stay healthy. We're all on the same page, and when they should, if they need to, access ER. So I know that was the first question with coordination. What was the second question?
So what happens when a tourist tests positive for COVID-19? Do they continue their medical care at the hospital, or if they're feeling better, do they quarantine at a hotel?
So when someone, let's say, is suspicious for COVID-19 and they require testing, we will provide the services to do the adequate testing. And then it would be the same protocols we usually would for any residents and or visitors coming to the ER. We have the outdoor tent still set up to try to maximize the level of protection. Everyone who needs a test will definitely get a test. We do have our Panther machine up and running, so we have the capability of doing 1,000 tests a day if we needed to. We haven't had to yet, but we're prepared. If you come in and we determine that you do need hospitalization, then you will be treated, residents and visitors alike, to be brought into the hospital under the safest circumstances, private rooms, universal masking, and all the other protections that we usually have to take in place. If you don't need to be admitted, so let's say you have symptoms, but you're not that sick, you're not hypoxic, you're not having severe chest pain, you don't have any signs of a heart attack or stroke or anything else that requires admission, we would probably discharge you to the hospital, but with the same quarantine protocols we would with anyone else who's showing up to the emergency department who's going to go home. That includes staying in wherever you're staying, be it in a hotel room. And my understanding is that the hotels have separate quarantine zones, I believe, that are trying to minimize the amount of contact. Now, our tests typically come back within 4 to 5 hours, so we would know. Now, assuming that the tests come back positive, they would still be recommended to follow the same rules as we would for you or myself who would go home, as in a separate bathroom, hand washing, wearing masks, not basically mingling with anyone else outside your immediate family who you've already been exposed with. And if your family members do not have COVID, probably need to stay away from them as well. And of course, if they or anyone else gets sicker, requires medical care, then we would alert to have EMS be prepared to transport you back to the hospital under the safest circumstances, wearing all the appropriate PPE, and then you'll be admitted or taken care of, or at least evaluated, chest x-rays and labs and everything else we need to do.
Okay, you have touched on this a bit, that Maui Health does expect a surge in cases with the reopening. What measures are currently in place in preparation for that potential surge?
So just to remind everybody, we already had some protocols in place, not just the tent outside and universal masking. And unfortunately, we are still keeping our visitor policy in place, which means other than children, for example, who have to be accompanied by their parent, one parent, or someone who is in absolute need of care where you need to have that second person there, we are limiting any visitors coming to the hospital. Just to touch base on that, we do use all of the modalities we have in place, FaceTime, phones, and we have iPads too to help communicate, because we understand that communication is really, really important. And we don't usually get the full story from just whoever's showing up at our front door. And I do know that family members are very interested in participating in the care and helping out, especially if we're going to be sending people home. In addition to what we used to do, anyone who's coming to the emergency department not only gets a test if you're suspected, so fever, cough, shortness of breath, or if you're not even suspected and you're going to be in the hospital a prolonged period of time, we're retesting you on day 3, I believe, day 5. We're doing multiple repeat testing of anyone who's going to be admitted. As far as the staff goes, I believe we're doing at least, after we did this mass test of everyone in the hospital, we're still proceeding with repeat testing of any frontline healthcare workers, anyone who's helping clean the rooms, anyone who could potentially be exposed to COVID. So we're doing maybe about 50 random tests a week. This is not including anyone who may or may not have symptoms or is concerned or may have any exposure. If there's any chance anyone could have a positive test, we're prepared through our employee health, which is working directly with the emergency department, so that we can have all the adequate testing and prevent any more spread.
Okay, this is a resident question. It's kind of a carryover from last time. What's going on now in terms of elective surgeries? Is the hospital reducing elective surgeries going in anticipation of a potential surge?
So at this moment, we are not reducing any elective surgeries. We do recognize the need to have elective surgeries before they become urgent or emergent surgeries, of course. Last time we had a lockdown and prevented elective surgeries or decreased the amount, we definitely saw a backlog, and we'd rather not try to get to that level again if we can. We are currently monitoring our census, our daily case counts, all of our PPE supplies, and all that gets figured and factored in as to when and how we should decrease. We likely won't go completely down to stopping right away. We'll probably be decreasing depending on our volume, just to make sure that everyone is safe. And elective surgeries, if it truly is elective, can wait, so we can have the appropriate supply and the adequate staff to care for everyone safely.
Okay, and also in line with the policies in place, is there still a no visitor policy at the
Yes,
hospital?
unfortunately, I said that a little bit earlier, we do have a no visitor policy. I do believe there is some exceptions that are made, but they have to be on a case-by-case basis. I know for sure anyone who's a child with a parent or a guardian, that's a definite visitor that's allowed.
And you had touched on this earlier as well. If the hospital has ample tests, how many do you do per day? And is Hawaii expecting any shortages going forward in supplies?
Okay, so how many are we doing per day? Depends on how many cases, elective cases, admissions to the hospital, and how many suspected patients. I believe we haven't been doing more than 100 a day at the most, but that includes anyone who's going to be coming in for elective surgeries, anyone who's coming through the emergency department. Again, we don't usually wait until we're for sure going to admit you. If I suspect that you're going to need admission, I'm probably taking that test right now so we don't prolong your emergency department stay any longer than we have to. So we do more than just everyone who's going to be admitted. And this doesn't include all the employee health folks who are still getting checked out. I believe we had 30 people yesterday alone who are staff members who are getting tested again. So we're doing a fair amount, but well below the 1,000. As far as test capability, I know we still have the capacity at Maui. We still have up to 1,000 tests that we can run a day, and that's just using our Panther machine. We still have our Luminex machine. We still have other modalities we can implement, but we're concentrating everything on this one machine, which is very good. It's a PCR test. It's rapid in terms of 4 to 6 hours at the most, depending on what time we put it on the machine and process it. As far as the state of Hawaii, I hope we have enough. Every news story that I've read or heard or watched, it definitely has me concerned. There can never be enough tests, and with visitors coming here now, you have to expect a few of them will become positive. Some of them will be asymptomatic on initial arrival and will become symptomatic sometime during their stay. So we have to be prepared for that. Are we expecting a surge? Are we planning on a surge? Well, yeah, we are planning for it. Because if you don't plan for it, then you won't be ready for it if it does hit. I would rather, and everyone else at the hospital would rather prepare for it, plan for it, be ready for it, and have nothing happen. We've been very fortunate here on Maui, very, very fortunate with looking at the stories in California or the Rust Belt of Illinois right now. And we'd really love to keep it that way. We do understand, though, that visitors, businesses are the lifeline of our community. We do need to find a nice balance in between. We would just like to see it done very safely. I can't stress enough. I mean, testing is important. More testing is always better. I believe I read this somewhere recently too, but the most important thing is to treat everyone as though they were positive. That's not just in the hospital. Like in the hospital, we do treat everyone as though you are positive, because if we're wrong, then we're in trouble. When you go outside your household, outside of anyone who's in your immediate family, so that's even guests who are coming over to your house, you got to still stay distant. You still got to stay at least 6 feet apart. You still got to stay far enough apart that if wind's blowing or you're in a confined room with AC, you got to be careful. And you should definitely be wearing a mask at all times when you're out and about. In the stores, at the hospital, at your workplace, you always got to be careful and vigilant, because you just never know, and you don't want to catch it if you can.
Okay, from a medical perspective, do you believe that the current 72-hour test prior to travel is sufficient to prevent the spread of COVID?
From a medical perspective, I don't think 72 hours one-time test is sufficient to completely rule out and keep out COVID. It will hopefully prevent those who do have a positive test from traveling and identify them. So that's a definite bonus. I believe the last figures that I heard, we were not getting 100% compliance with the pre-testing program. And that's to be expected. There is an option. I don't believe we can force everyone coming to Hawaii to get a test, although that would be, from a medical perspective, the most ideal situation. Ideally, a pre-test before you come here and a test somewhere between day 3 and day 7 would catch majority, if not all, the cases of everybody. And I believe Dr. Libby Char, who's now in charge of DOH, explained the exact same scenario. If we had enough tests, enough capability, then this is what should be done. And I have trust in her and the DOH now to proceed with a second test as soon as all the test capabilities are maxed out or increased, I guess I should say. As we currently have it, I believe we are expecting many asymptomatic cases with negative initial COVID tests to leak through. So this is why the mask wearing outside for both visitors and for locals, to be honest, lots of hand washing, keeping your distance. That's the most important thing, to try to keep the spread down. If we could increase the testing to a second test, I know we'll catch more. We will probably be able to help manage and catch, but if you're asymptomatic and you're not that sick, it's not going to change your management. You still should wear a mask. Obviously, you don't want to be on a plane next to somebody going home who does have COVID, but hopefully you're not on a plane with someone who's got COVID coming here either.
Okay, this is a hospital-specific question. Has the mandatory testing requirement for employees who travel changed since the state reopened to visitors?
So our employee return policy has not changed in terms of we still require that if you do travel, and we are discouraging any travel that's not immediately urgent or emergent to, for just fun or for vacationing, to be discouraged. But if you do, it's your right, and we do expect you to take a test prior to starting your first shift, and it has to be negative. Once you come back with a negative first test, you still maintain the same protocols, pretending that you were positive. So you got a mask on, you're still keeping any distance. This includes our lounges, our cafeterias, and everywhere else that we would commingle in the locker rooms, for example. And then we would repeat your test again on day 6. Then you'll be cleared. This is a little bit above and beyond what the state is already mandating. And we're always trying to keep an eye on what DOH and what the state has in mind, so we're complying, and always trying to go a little bit above and beyond what they're recommending, just for everyone's safety, patients and staff.
Okay, doctor, is there any other closing thoughts that you had in terms of the reopening and the testing available to Maui right now?
Closing thoughts, I would say thank you everyone who have been wearing masks and keeping your distance and doing the right thing. You can get really fatigued by all this. I know we are. I am. It's been a very long year this year. But we just can't let up right now. We really got to keep our foot on the pedal. If we lighten up, if we don't wear masks, if we start getting gatherings because we're just tired and sick of it, the holidays are coming. I understand. I want to get together with family too. But we got to be careful and we got to be smart so we don't spread the disease. The hospital will always be here. We've been here before. We'll always remain here for everyone. We've been preparing and have always will be preparing. We're going to get all the latest data with regards to the vaccine, hopefully, if it's going to come anytime soon, how we're going to distribute it, how we're going to protect everybody. And if there's any changes in protocol, any changes in testing regimen, we'll probably be on top of it. Don't worry about our PPE stores for right now. We are more worried about than everyone else, trust me. In this lull we've had the ability to build up some of our supplies, so we're prepared. But even on this morning's emergency operations center call, we were saying that although we have an adequate supply for so many days in the future, don't stop looking for it. We're telling our supply managers to keep on the lookout. I know we have a partnership with Kaiser so that if we do need a rush of medications or supplies, we do have that availability, as well as HIEMA. Everyone's been on board and prepared to help us out as well.
Again, we'd like to thank Dr. Ayasanonda, Emergency Department Physician and Co-Director with the Maui Memorial Medical Center's Emergency Department. If you'd like more information on this topic, we have the full details posted online at mauinow.com. For Maui Now, I'm Wendy Osher.